A very good morning to one and all. Today we'll be dealing with Clostridium tetani. Clostridium tetani, as you all know, the gram-positive bacilli, slender bacilli with spherical terminal spores have characteristic drumstick appearance. They are encapsulated and endowed with a peripheral flagellate. The young cultures, they are strongly gram-positive, whereas the old cultures, they tend to become gram-mediable or gram-negative. And they are very resistant. Most of the strains are killed by boiling for 10 to 15 minutes. Some places boiling for 3 hours. They need to be articulated at 121 degrees Celsius for 20 minutes to kill the spores of the strains. The spores they survive in soil for many years. They produce two distinct toxins, tetanolysin, which is a limonlysin, and tetanospasmin, which is a neurotoxin. And the properties of tetanolysis include it is heat and oxygen labile, can lyse the RBC of animals. They can act as a leukotoxin, but the pathogenic role of tetanolysis is not clear. Coming to the tetanospasmin properties, they are proteinaceous in nature, which is heat labile and oxygen labile. It's a powerful neurotoxin, which is rapidly destroyed by the proteolytic enzymes. They are plasmid encoded and it is responsible for the most of the clinical manifestations of tetanus. Tetanus plasmin is lethal to mice and pigs, even at a minor doses. It's a good antigen and specifically neutralized by the antitoxin. It can be toxoided by the treatment with formaldehyde. And this formaldehyde toxoid is used for the vaccine preparation. So this is how it can be toxoided by the addition of formalin. The toxin, formalin treated becomes the toxoid, where the toxin moiety is changed, but antigen remains the same, and that is used for the vaccine preparation. Loses the virulence property. And mechanism of action of tetanus toxin. The toxin it binds to the receptors which are present on the motor nerve terminals, which result in toxin internalization. Once internalization occurs, the tetanus toxin gets transported in a retrograde way to the GABA and glycine producing inhibitory neuron terminals. Toxin prevents the presynaptic release of inhibitory neurotransmitters, glycine and GABA, and this leads to the spastic muscle contractions. So, these are the mode of actions by which the spasmin acts. So, coming to the pathogenesis, mode of transmission is through injury or surgery done without proper asepsis, and in neonates, following abortions or delivery or due to unhygienic practices. Clostridium tetani, they have got less invasive power. So tetanus follows following the contamination of wounds with Clostridium tetani spores. It may be through soil, dust, feces, etc. The infection remains localized in the wound. Once a favorable condition occurs, a neurologic environment sets in, the germination of spores occurs, and the toxin production occurs. And the pathogen, most of the pathogenic effects they are due to this tetanospasmin, which is a neurotoxin, which acts presynaptically, blocks the synaptic inhibition of the spinal cord. There is the inhibition of spinal inhibition leading to uncontrolled spread of impulses initiated anywhere in the nervous system, results in muscle rigidity and spasm due to the simultaneous contractions of agonist and antagonist. So we have clinical manifestations. Next, the incubation period is about 6 to 10 days, where the muscle of the face and jaw are affected first. And so the first symptom to appear is the increase in masseter tone leading to trismus or long jaw, followed by muscle pain, stiffness, back pain, difficulty in swallowing, etc. And in neonates, there is difficulty in feeding. This is the initial presentation, and it progresses to painful muscle spasms, may affect the limb, or they can be seen as dissenting spastic paralysis. And complications include abnormal sustained spasm of facial muscles producing grin. Then there is opposite positions, the abnormal position of the body due to the generalized spastic contraction of the extensor muscle. respiratory muscle spasms which obstruct the air. Autonomic disturbances which result in severe tetanus include lower high blood pressures, tachycardia, intestinal stasis, sweating, increased tracheal secretions, acute renal failure. Next, coming to the laboratory diagnosis, mean swabs and exudate of tissue from the wounds are taken. First, we do the gum staining to observe the drumstick appearance. And culturing is usually done in fluorescence cooked meat where the meat particles turns black, the proteolytic activity. And in blood agar, which is mixed with polymixing, you can see a swarm effect. Prophylaxis include the surgical removal of foreign body, blood clothes to prevent the anaerobic environment. Antibiotics like penicillin and erythromycin can be given. Immunizations include the active immunization, passive, and the combined. Active immunization, which is the most effective method where tetanus toxoid, formaldehyde treated toxin given at a dose of 0.5 ml intramuscularly. This tetanus toxoid they can be given along with the DPT at the 6th, 10th, and 14th week of birth, and the booster dose is given at 16 to 24 weeks and at 5 weeks. Additional two doses of tetanus toxoid is given at 10 years of age and 15 years of age. For the prevention of neonatal tetanus, all the pregnant women are given two doses of TT at the interval of 4 years. Passive immunization, anti-tetanus serum, which is prepared by immunizing horses with toxoid for preventing tetanus, but due to its hypersensitivity reactions, this ATS is now uh, is banned, and now we go for human anti-tetanus immunoglobulins as a passive immunization. And the combined prophylaxis in non-immune persons, we give tetanus toxoid active immunization along with a passive immunization with HT. Thank you. Thank you for listening.